Investigates tonight is looking into one rapid test for COVID-19 that seems to be getting popular. It's called an antigen test, and you get results in just 15 minutes. But as Karen Anderson tells us right now, there is concern about whether people understand the test limitations of why it got a green light for use.
Antigen tests are a growing choice for people who need a negative result to travel, return to work, or visit a loved one. But 5 Investigates found that's not necessarily how the FDA intended antigen tests be used. Dozens of people lined up down one street and up the next. Some brought lawn chairs, others their laptop. It's a little before 8 a.m. in Needham, just outside Carewell Urgent Care. Most of the people here told us they're in queue for a rapid COVID-19 test, hoping to get clearance for travel or work.
I need the quick response, the 15-minute response. I don't want to wait 6 to 10 days.
Josh Musher needs results now so he can attend an out-of-state family reunion. He opted for the 15-minute antigen test, advertised on Carewell's website, along with other testing methods like PCR, the traditional nasal swab processed at a lab and considered the gold standard. This antigen test, also a nasal swab, is less sensitive but can be processed on site.
It's really good at picking up people when they're very infectious, but it will miss some chunk of people, particularly people without symptoms who are infected.
Dr. Ashish Jha, director of the Harvard Global Health Institute, says that chunk of people who are missed getting false negatives can be 50% or more.
So the false negatives really depends on where you are in the disease course.
The FDA authorized the Quidel antigen test for emergency use in May. But you can see it was authorized for individuals who are suspected of COVID-19 by their healthcare provider within the first 5 days of the onset of symptoms. Not for someone who's asymptomatic or expecting a negative result.
I don't have any symptoms. I feel fine. The probability that I have it is low.
The antigen test was not intended for this.
The state is receiving results from antigen tests. We asked several times, but they wouldn't tell us how many of those tests have been given. They're also not putting that information in the daily public reports.
It is really incumbent on us as a medical community to make sure people understand what the limitations of these tests are.
Carewell has a link on its website pointing to this FDA fact sheet for patients. It explains a positive result is highly accurate, but a negative test does not rule out an infection and may be incorrect.
You've come back from travel and you're quarantining. The test is not for that, and a negative test will not be the kind of reassurance you need that you won't go out later and infect somebody in the next few days.
Dr. Jha says antigen tests do have a very important role in surveillance at schools or nursing homes when the tests can be repeated every couple of days on the same people.
But those are surveillance tests. Just for asymptomatic people who want to test themselves once, you're going to miss too many people to be confident that those people are not infected.
Josh got his results back in about 15 minutes, which were negative. Now, we reached out to Carewell for a comment. They didn't respond. State officials want to make it clear a negative result in an antigen test is not enough to override the quarantine in the Massachusetts travel restrictions. You need to have that result backed up by the standard PCR test. Karen Anderson, 5 Investigates.